Welcome you all to today's discussion. Today's discussion is about surgical instruments. Though it is a vast chapter, I would like to discuss you in several parts. The commonest question is, what are the name of the instrument, how you identify the instrument, what are the use of that instrument, and the technique of sterilization of that instrument. The commonest technique of sterilization in and around the operation theatre is autoclave. Autoclave machine may be like pressure cooker type, or it may be like modern horizontal autoclave machine. The benefit of autoclave is it will destroy spores. Its principle is 121 degrees Celsius temperature in 15 pound per square inch pressure for 15 to 20 minutes. The term 15 pound per square inch, not lb per square inch. In high pressure, vapor has more penetrating power than normal pressure, and when the vapor condensed into water, it releases a large amount of latent heat. Another process of sterilization is boiling. There are two terms. One is sterilization and one is disinfection. Sterilization means killing all microorganisms, all bacteria, bacterial spores, fungus, virus. But in disinfection, the spores cannot be destroyed. The process of autoclave can destroy all, but boiling can't eliminate the spores. The spore-bearing organisms are Clostridium, which are responsible for tetanus and gas gangrene, and Bacillus, which are responsible for anthrax. Boiling is under normal atmospheric pressure. Water boil at about 100 degrees Celsius temperature, but temperature cannot be raised because then water is changed into vapor. These two are physical method by heat. We always remember only blunt instrument should be sterilized by these methods, but sharp instruments like scissors should not be sterilized or disinfected by this method because this will lose its sharpness. So we sterilize the scissors with chemical sterilization by dipping in Lysol, or nowadays 2% glutaraldehyde is available in this laparoscopic era. We use 2% glutaraldehyde solution, which is known as Sidex as commercial name, and we use this Sidex solution to sterilize the laparoscopic instrument, the endoscopic instrument, cystoscopic instrument, and also our sharp instrument used in operative surgery. Sterilization occurs by 2% glutaraldehyde if it will dipped in it for 10 hours. But high level of disinfection can be achieved by dipping it for 20 minutes. And other common methods of sterilization related to surgical works are done in industry, that is by ethylene oxide gas or gamma irradiation. These are available in industry and they sterilize all commercial instruments like BB blade, scissor material, syringe, disposable syringe, catheter, etc. in industry by this technique. Session will also be helped me by my little daughter Sanjida Islam. These are the common surgical instruments. All surgical instrument has some common parts.
Ready.
These are the finger bows in which the fingers stand. This is ratchet or catch. Some instrument has ratchet, some has no. This is the shaft of instrument, the joint of instrument, and this is the blade of instrument. Different instrument has different type of these parts, and commonly we use our ring finger and thumb to enter into the finger bows, and index finger and middle finger used to stabilize the instrument. Now we shall discuss about hemostatic forceps, whose nickname is artery forceps. It is most commonly used forceps in general surgery. It has different sizes. The criteria of identifying this instrument is the hemostatic forceps has finger bows, ratchet, shaft, joint, and blades. The blade has transversation along whole of its length, and the tip is conical, non-toothed. The hemostatic forceps is used in so many areas in general surgery. During it holds the blood vessels for hemostasis. When it holds the blood vessels, the vessel wall crashed and hemostasis occurs. We also hold it to blood vessel and give ligature or electrocautery is given. During laparotomy, we used to hold the linea alba or peritoneum. Before incising the peritoneum, we just hold peritoneum like this and feel any viscera or part of intestine in between, and then incise the peritoneum to open the peritoneal cavity and thus avoiding injury to the underlying structure. In closure of laparotomy, we commonly hold the peritoneum with this hemostatic forceps during closure of peritoneum. In appendicectomy operation by gridiron incision, after opening of external oblique aponeurosis, we split the internal oblique and transversus abdominis with this hemostatic forceps. Again, before closure opening of the peritoneum, we hold peritoneum and open the peritoneum like shown in before. This hemostatic forceps also used to crash the base of appendix. In resection anastomosis of intestine, we often hold the mesenteric vessels with this hemostatic forceps. For venesection, we dissect the vein with this hemostatic forceps. In abscess drainage, we can use this hemostatic forceps instead of sinus forceps, that will be shown in later. We hold the tail of scissor material with this hemostatic forceps. And another, its common use, it is used for dressing purpose. The hemostatic forceps may be in different sizes. It may be long like this, it may be medium size like this, and it also may be very small size like this. The small size hemostatic forceps are called mosquito forceps. Again, this can be carved like this or it can be straight. These forceps are sterilized by autoclaving. The common matters associated with hemostatic forceps is hemorrhage. It is the escape of blood from blood vessels. It may be arterial, venous or capillary. Arterial bleeding is always spouting bleeding and it is bright red in color. The venous bleeding is continuous flow and it is dark red. And the capillary bleeding is characterized by oozing. It is also bright red in color. Again, hemorrhage can be classified according to the time of onset. It may be primary, number 1 primary, number 2 is reactionary, and number 3 is secondary. There is a common mistake that is often we say the primary then secondary, but it's mistake. Primary bleeding occurs at the time of operation or at the time of injury. The reactionary bleeding occurs within 24 hours. It may be due to slippage of ligature or dislodgement of a clot, which occurs due to straining, coughing, or rising of blood pressure during the reversal from anesthesia. And third type is secondary bleeding that occurs after first week, usually 7 to 14 days. The secondary bleeding may occur due to slough out of vessel wall by pressure from a drain tube or a piece of bone. It may also occur due to infection or any malignancy. There may be another classification is concealed hemorrhage and revealed hemorrhage. And there is another one is initially concealed then revealed. Revealed hemorrhage is that is visible hemorrhage, that is obviously bleeding from any trauma, cut injury. And the concealed hemorrhage that is not visible from outside. Hemorrhage inside the body cavity. Commonly in blunt trauma, there is ruptured spleen or ruptured liver, and there is profuse bleeding in peritoneal cavity. It also occurs in ruptured ectopic pregnancy. There is fracture, close fracture bones. We commonly use a term blood in floor and four more. The blood in floor is obvious bleeding, that is revealed hemorrhage, and another 4 is concealed hemorrhage. Number 1 is in bleeding in peritoneal cavity, number 2 is pelvic cavity, number 3 is thoracic cavity, and number 4 is muscle compartment. Another is initially concealed and then revealed. This can occur in bleeding peptic ulcer or carcinoma stomach, where the bleeding occurs in stomach but after it revealed as melena or hematemesis. It may be present as hematuria. The initially concealed then revealed hemorrhage can present as hematuria, like hemoptysis, hematemesis, melena, etc. And the amount of blood loss. We should get an idea. The amount of blood loss is cleansed fist. The amount of clot in a cleansed fist is about 500 ml. We can also calculate in a fracture shaft of tibia can conceal hemorrhage about 1 to 1.5 liter of blood. In long bone fracture like shaft fracture femur, close fracture can occur hemorrhage in muscular cavity about 1.5 to 2 liter of blood. During operation, we also calculate the amount of blood loss by taking weight of mob and gauze before and after surgery. And the calculation is the amount difference of swab before and after surgery with multiplication with 1.5 to 2. This may be give the idea of total blood loss in a operation. And the hemorrhage control. The hemorrhage control can be achieved by several techniques like pressure, pack, tourniquet, elevation of limb, and finally in operation theatre we commonly use the ligature to control the hemorrhage and also use the electrocautery or diathermy to control the hemorrhage. Now we shall discuss about Cocker's hemostatic forceps. It has finger bow, ratchet, shaft, joint like other hemostatic forceps, but its blade has tooth and groove in its tip that is absent in hemostatic forceps. The most important identifying criteria of this Cocker's forceps is presence of tooth one side and groove on another side, and it will be opposed on another when the ratchet is closed. The blade is also has transverse serration of its whole length. This Cocker's forceps is commonly used to hold the tough structures like aponeurosis, linea alba. It used to hold the bleeding vessels in tough structures like palm, sole, scalp, etc. In this laparoscopic era, many laparoscopic surgeons use this Cocker's forceps at the opening of first laparoscopic port, and also use this when closing the port by holding the linea alba with this instrument. Now we shall discuss about Lister's sinus forceps. It's commonly known as sinus forceps. It has finger bow, shaft, joint. It almost near like to hemostatic forceps, but it has no ratchet, and serration is transverse serration of the blade only near its tip. It is, though it is conical, but it is blunt. It should not do any injury. It is commonly used to drain the abscess. As we know, the abscess is localized collection of pus in a cavity lined by pyogenic membrane. It can occur in different parts of our body. It can occur in deep part like liver abscess, residual abscess in peritoneal cavity. It can occur in superficial part, subcutaneous area. It can occur in axilla or groin. When this abscess occurs in axilla or groin, during the drainage of abscess, there may be injury to underlying vessels. So we use this sinus forceps to avoid injury of underlying structures. It is sterilized by autoclaving, and the method of this abscess drainage is by Hilton's method, and the abscess is often has multiple loculi, so it is important to break down the loculi with this sinus forceps or using a finger. Now we shall discuss about Moynihan's cholecystectomy forceps. It is a stout and heavy instrument with finger bow and catch. Its blades are relatively small in relation to its shaft, and the blade has transverse serration and the tip is angled. These forceps are commonly used in cholecystectomy to hold the fundus or Hartmann's pause, and another pair is used to dissect the Callot's triangle. Again, in cholecystectomy, this forceps is used to pass the ligature beyond the cystic duct or cystic artery pedicle like this. These forceps often used to dissect the ureter during ureterolithotomy, and as other blunt instruments, this instrument is also sterilized by autoclave. Now we shall discuss about needle holder, which is used to hold the needle for suturing purpose. It has a very short, heavy or stout blade in relation to its shaft, and there is criss-cross serration in its blade, and there is a groove at the central part of blade to accommodate needle. It can be different in sizes. It can be large to suture a deep structure, it can be medium size, or it can be straight, small size. Again, it can be straight or curved. We use needle holder to hold a needle. We hold the needle at the junction of anterior 2/3 and posterior 1/3 like this. This blunt instrument also sterilized by autoclaving. Now it is Alice tissue forceps. It is a light instrument with long blades. There is a gap between this long blade to accommodate some tissue in between. The tip of blade has tooth and serration, and when the ratchet is closed, they oppose to one another. The Alice tissue forceps can be different sizes. It can be long, it can be medium or short. We use this forceps in several purposes in surgery. In midline laparotomy, we hold this forceps to detect the skin while incising the linea alba. Again, we hold linea alba with this forceps while incising it. Also, it should be used to hold any tough structure like aponeurosis, rectus sheath. We use to raise skin flap with this tissue forceps in thyroidectomy or excision of lipoma, sebaceous cyst, etc. For operation of incisional hernia, we use this Alice tissue forceps to raise the skin flap. Again, we hold this Alice forceps to fascial sheath while dissecting the hernia sac from it. This can also be used to hold the cut margin of bladder in suprapubic cystolithotomy or transvesical prostatectomy. This blunt instrument also sterilized by autoclaving. Now we shall discuss about Babcock's forceps, which is commonly used forceps for appendicectomy. The tip of its blade is curved and there is a triangular fenestration in each blade. This curve is accommodate it a tubular structure like this, and this fenestration allow bulge of some tissue from it. The tip of blade has groove and ridge, and they oppose one another when the ratchet is closed. So it is a blunt forceps and non-traumatic forceps. We commonly use this instrument to hold the appendix during appendicectomy. We also use this to hold the fallopian tube or ureter or part of bowel. During gastrojejunostomy or gastrectomy, we hold the margin of stomach with these forceps before application of occlusion clamp. Again, in resection anastomosis of guard or anastomosis of guard, we also hold the margin of guard with this forceps before application of occlusion clamp. In choledochoduodenostomy, before giving incision over duodenum, we hold the duodenum with this forceps and incise it. Occasionally, we hold the cut margin of bladder in suprapubic cystolithotomy or transvesical prostatectomy with this instrument, and sterilization of this blunt instrument is by autoclaving. And this is the Rampley's sponge or swab holding forceps. This is a very long instrument with finger bows and ratchet. Tip of this instrument is flat, oval, and there is a oval fenestration in this blade, and there is transverse ridge. We commonly use this instrument for antiseptic cleaning of operative area with holding a sponge or swab. The ideal area for cleansing in abdominal surgery is from mid-chest to mid-thigh. We also use this instrument to hold the fundus or Hartmann's pouch of gallbladder, as it is a blunt forceps appendicectomy. We use this forceps to swab the abscess cavity. This can be used to hold the tongue as tongue holding forceps, and commonly gynecologists and obstetricians hold the cut margin of uterus during cesarean section. As this is a blunt instrument, it also sterilized by autoclaving like other blunt instruments. Another instrument just look like to sponge holding forceps is ovum forceps. The difference between sponge holding forceps and ovum forceps is ovum forceps has no ratchet and the blade has no oval fenestration like this sponge holding forceps. The ovum forceps is commonly used by gynecologists and obstetricians, but with the laparoscopic era, the most laparoscopic surgeons prefer this for retrieving the stones from gallbladder lumen after partial removal of the gallbladder outside the abdominal cavity, and this ovum forceps is also sterilized by autoclaving. This long instrument is Chattel's forceps, or commonly known as lifter, and it has no ratchet or catch. It is used to pick or lift sterilized instruments and drafts, and it is kept dipped in antiseptic solution in a jar like this. This long, slender, beautiful instrument is Desjardins choledocholithotomy forceps, which is used to remove stone from CBD in choledocholithotomy, and it also may be used to remove stone from kidney, ureter or bladder. This fine instrument has gentle curve to accommodate in common bile duct, and its tip has oval fenestration to hold the stone. This instrument also sterilized by autoclaving. This is towel clip, which may be Mayos type towel clip, or Doyle's type cross action towel clip. This is used to fix draping sheet in operative field and also fix suction tubes, diathermy wires, laparoscopic cables with draping sheet. Occasionally it used to hold the ribs in flywheel chest.
Thank you all for watching this video.
Thank you.